Um, Sometimes I wonder what's going to be the bigger challenge, the actual distribution of the vaccine or the public relations campaign?
Yes, the skepticism about vaccines has always been an issue. And here where you have, politicians kind of motivated to say, they performed a miracle, the skepticism is higher than ever. In fact, our current president was actually a vaccine skeptic. So this current situation is the most difficult in terms of vaccine acceptance. What I'm hoping is that as the first 20 or 30% of the population who are most at risk come forward, people will say that it's going well. And so the attitudes, they'll realize you're protecting other people by taking the vaccine as well as protecting yourself. I do think, the logistics will be tough. The same way we have drive-through testing now, we ought to be able to create drive-through for the vaccination as well.
Let me ask you this. You've been working with your foundation trying to, help with vaccinations around the world for years. Tell me how you go into a community that's skeptical of just medicine in general and end up convincing them to take a vaccine.
Yeah, we see vaccine skepticism everywhere. It's probably highest in the United States, which there's a certain irony to that. But you always have to think, who do people trust? So in Nigeria, we worked very closely with the Muslim leaders because households, saw those leaders giving, this is the polio vaccine that there were bad rumors about. They saw those leaders giving it to their children and no ill effects there, and we were able to get rid of wild polio throughout all of Africa. That required way over 90% of the kids to take actually what is a 3-dose regimen there, but we had to put a lot of money behind it and figure out who would be trusted, and in some cases, if there were refusals, go and follow up to try and help raise that dosage rate.
Your role in the foundation, your role in warning the world, if you will, about your concern 5 years ago when it came to, frankly, that the world wasn't ready for a pandemic like this. You've been thrown into the conspiracy theory world. You've been used as a foil by those on the far extremes of whether it's the anti-vax movement, whether it's extremism here on social media. What have you tried to do to combat this?
Yeah, I think both Dr. Fauci and I, there's, things that are suggesting really malign intent. And, that is surprising. And, I hope it doesn't reduce people taking the disease seriously, wearing masks. As the data comes out and there's an approved vaccine, being open-minded that is contributes to the community, that you're less likely to spread the disease when you're vaccinated. I wouldn't have expected this. I mean, our foundation is about saving lives, and it's about spending the money to save lives. And the fact that some of these rumors kind of turn that around, it's a very novel thing, and I hope that the truth can be made as interesting as the lie.
Have you? Where I want to go here with this is here you are, one of the sort of the founders, if you will, of modern technology for all of us. Okay, and you helped create one of the companies that's the pillars of technology around the world, and yet in some ways, it's social media in particular, which I know in some ways you in some way were not involved in the rise of social media. But this puzzle, social media has turned out to be a weapon against truth, a weapon that's being used against you, a weapon that gets used against us in the press. What can we do about this?
Yeah, it is a problem. And, this movie, The Social Dilemma, highlights the problem. More difficult is what are the answers? Because a little bit, it's preying on a human weakness, that these kind of wild theories that aren't true spread very, very quickly. And, people can just get in to almost a rabbit hole of reading things that are outrageous and get a very us versus them, where they're not seeing the mainstream facts, and we're very polarized. I think something needs to be done, but the suggestions of how you preserve the flexibility, some level of free speech,
right.
And the benefits of these systems, while knocking down the fact that the conspiracy theories literally take millions of people and make them think, oh, I won't wear a mask.
Right.
That is a big problem.
Did you ever expect that what was supposed to democratize information and democratize access ended up fueling what we're seeing today? I mean, I have to be honest with you. I'm not sure what good comes out of social media right now.
No, social media, I'll stick up for it a tiny bit. Connecting families at a distance, people with common interest. If you look at the digital world in general, it's allowed some people to work at home. It's allowed the research to be shared about this disease at the rapidest pace ever. So the digital realm still has a lot of very positive things coming out of it. And so I'm hopeful we'll see creative suggestions.
Right.
How do you mark things that are false? How do you slow them down? How much of a burden should there be on the companies? How do you get communities of people working together to try and minimize these false beliefs that are making the pandemic worse?
It's funny. We just had this issue in Michigan, these militia members trying to kidnap the governor of Michigan. And look, the FBI had an informant. That was very helpful to them. But they did a lot of this planning using encrypted messages. And the question is, what is that line for these tech companies? Let's take Facebook in particular. Where should they be accountable for, maybe their algorithms or their encryption versus how much are they accountable to protecting a private citizen?
Well, I'm someone who believes that what the government had relative to the phone companies, where they could look into sex rings or organized crime, going through a court approval process for wiretapping, that equivalent needs to be maintained for the government with good safeguards. That's even considered controversial, that law enforcement, maybe they should go blind for a lot of these things. I don't know that particular case, but I do think wiretapping net has been very beneficial.
So let me see if I get this straight. Yesterday, you had Chuck Todd and Bill Gates spend nearly 8 minutes on Meet the Press discussing how horrible it is that citizens now have the ability to share information with one another, and, more importantly, how we avoid the mainstream media, which we know they're the voice of the unspeakables, of the elite, how we avoid that propaganda and lies. And the result of this is that something needs to be done. As a matter of fact, you had Bill Gates then say, you know how great it is that the government taps our phones? He suggests that maybe they should start tapping the internet. And of course, that's to keep tabs on everyone that's pushing back against their lies and misinformation. That's why they brought up Governor Whitmer in Michigan. And then when you have Bill Gates on, the topic is Rona. Speaking of Rona and pushing back, and a story that they definitely don't want to come to light, I bet you anything they don't want me talking about this.
You cannot fight a fire blindfolded, and we cannot stop this pandemic if we don't know who is infected. We have a simple message for all countries: test, test, test. Test every suspected case. So far, we have seen epidemics in countries with advanced health systems, but even they have struggled to cope. As the virus moves to low-income countries, we're deeply concerned about the impact it could have among populations with high HIV prevalence or among malnourished children. That's why we're calling on every country and every individual to do everything they can to stop transmission.
What we do know is that we need to double down our testing efforts.
I guess I should start by asking you to react to what Meg just reported on there, this consortium that has developed a test, costs $80. It apparently delivers results very quickly. What do you think?
Well, first of all, we need all the testing opportunities that we can get. And
Mr. President, how could the administration discuss the possibility of reopening the country when the administration does not have an adequate nationwide testing system for this virus? Don't you need a nationwide testing system for the virus before you reopen?
We have a great testing system. We have the best, right now, the best testing system in the world.
And I know today you have a testing announcement, 100 million tests to states, and you were really earmarking, that's for schools, and 50 million to protect vulnerable communities, a lot of that going to nursing homes.
When you test, you have a case. When you test, you find something is wrong with people.
When you test, you find a case. You find out something is wrong with people. Finding out who is sick and who is not wrong.
Testing, testing, testing. Let's talk about testing.
Right now, the majority of tests being used to diagnose COVID-19 are genetic tests known as PCR tests. These tests are very accurate because even if there's only a tiny amount of virus present in the patient sample, PCR, which stands for polymerase chain reaction, is able to take genetic material from the virus, target specific gene segments that only the virus has, and make a very large number of copies of those segments so that they can be detected and measured. Using this method, a PCR test can tell you if you have COVID-19 right now, but not if you've had it in the past. Although this type of test usually delivers results in 4 to 6 hours, it's worth noting that PCR testing is very complicated and costly, and not all healthcare facilities have the ability to perform it. Facilities that can't run this type of test may have to send patient samples to a reference laboratory and wait several days for the results. On the other side of this spectrum, the FDA has also approved a few rapid PCR-based tests that give results in less than an hour. At least initially, these rapid tests were reserved for triaging patients in hospitals and for testing healthcare workers. Now that the production of these tests has ramped up further, rapid corona testing centers for the general public are starting to open in several states across the U.S.
Let's hear one more group of, quote, professionals talk about this polymerase chain reaction, or PCR, coronavirus test.
This is how most coronavirus tests are done in the U.S.
You stick a swab into somebody's nose and you pull it out, and what's on it? You have some of your cells. You have potentially virus.
To find out if the virus is on that swab, scientists use a process known as polymerase chain reaction, PCR.
Basically just a way of taking a small amount of nucleic acids, or RNA specifically for this virus, and turning it into a lot of nucleic acids so that you can detect it.
The new coronavirus contains RNA, a single strand of genetic information that sits inside a spherical casing.
So the first thing you have to do is to get into that genome. So after the swab, what you will then do is take what was on that swab and blow everything apart.
Chemicals are added to isolate any genetic material.
And then you take that tube and you subject it to a PCR.
Pieces of genetic material, called primers, are added to the tube.
right? So the primers are those small pieces of DNA that are going and looking for the genomic RNA. And if the genomic RNA is there, those primers will bind. And that binding makes a landing site for the enzyme to make that new copy.
This happens over and over again, creating millions of copies.
As that new copy is made, now you get fluorescent molecules coming in and binding to that new copy.
So, if that snippet of coronavirus genetic material is present, PCR will make lots of copies. And fluorescent molecules will make them glow. That glow means patient is infected.
Wrong. It does not mean that the patient is infected with something called Rona, something called COVID-19, SARS-2, whatever name they want to give this, novel that. How do I know that she's wrong? How do I know that all of the people that have been participating in this fraud that is this PCR test? Well, let's go all the way back and figure out, where did the PCR test come from? Who invented the PCR test?
Polymerase chain reaction, or PCR, is an invention I had in about 82, 83. It's a way that you can produce a little teeny piece of DNA, a specific one, out of the whole genome and make as many copies of it as you wanted to, and there's no limit. Basically, it's a matter of putting together the trinucleoside phosphates, the things that the body would use in making new DNA. And you put in these two little things called oligonucleotides, which are like little single-stranded pieces of DNA. They're sort of pointing at it chemically, and they're saying, you, this sequence, make a copy of yourself every time basically that I heat and cool this solution. Go to that little spot and double it. It solves the two major problems in DNA chemistry, which was the specificity and amount. In '75, people had just discovered this molecular cloning, where you could isolate a DNA sequence and you could put it in a bacteria and you could make more and more and more of it. People thought about cloning as almost a miracle, but it took a long time. It would take a lab like mine, say, 6 months probably. It was such a neat, new, and exciting and spooky thing that nobody was looking for a quick way to do it. People thought, well, we're going to have to get along with the fact that DNA is a very vital thing that we all want to know about. You'll have a lot of it in total, but any one part of it, you'll never have enough to make it convenient to study. I was driving to Mendocino in the middle of the night, and I was just cruising along in my patterns of thought. And out of that, the concept of PCR became just obvious to me. It was something I already knew how to do in my lab. It was a matter of heating and cooling a tube, you know. The first notion I had was just stop. And I stopped right in the middle of the road. And I said, wait a minute, somebody's going to come along here and hit you. And I wrote with a gas receipt that I had in my glove compartment, wrote on that. And it was just so ridiculously simple that it took me a long time to really say, well, this would actually work. The next morning, fairly early, I went out to Jack's Valley store and bought a couple of bottles of red wine and drank them before I could go to sleep. It was a joyous kind of feeling, but it was also, I just doubted that it really would work. There's got to be, any minute now I'm going to see what the problem is here. At that point, genetic diseases were starting to be discovered. We knew that there was an awful lot of information in every one of your cells. It was real obvious that we wanted that information, and PCR made that possible in an incredibly simple format. Do you ever watch cop shows? And you know that they use DNA to trace somebody, to say who was here or who killed this person. All that stuff is first PCR, then you do the DNA analysis. The Nobel Prize came 10 years after the PCR was invented. It was a phone call one morning, you know, early in the morning, and I thought somebody was joking. It's an awesome thing. I probably was too young to really appreciate the awesomeness of it, but it was fun. They know how to put on a show. My mother came up to the front of the auditorium and like hugged me. She definitely was moved by the fact that one of her boys had got the Nobel Prize. You know, I didn't think of myself prior to that as really caring all that much about what the world thought of me, but that they thought about me in that way, I started thinking, maybe I do care. I mean, that probably was unexpected. It gives you the feeling, if you ever feel bad for any other reason, you think, oh, at least I got the Nobel Prize. Nothing will completely destroy my self-worth feelings. That sort of creeps up on you after 20 years or so, that, you know, you think of yourself as a Nobel Prize winner. It makes a difference. I don't think I know anybody who got one that wasn't really affected by it.
So, Kary Banks Mullis, inventor of the PCR, the polymerase chain reaction test, was born December 28, 1944, and he died tragically last year, August 7, 2019. Now, I say tragic because he did not get to see what his invention would eventually be used for, and that would be the testing of millions upon millions of people across the globe for COVID-19. And speaking of the pandemic, many of us in this community are not holding scientists in high regard lately, whether we're talking about their fear-mongering, their dishonesty, or their politicizing of science itself. With that being said, Mr. Mullis does not fit into that category. He was a man's man, wasn't dishonest. He always told it like it was, at least what I can tell. He wasn't around unspeakables. Even though he won the Nobel Prize for Chemistry in '93 for the invention of the PCR test, if you know anything about the Nobel Prize, it's basically a backslapping contest for unspeakables. They just hand them out like candy to each other. So, he actually deserved it. Now, the conspiracy theorist in me kind of has to wonder why they awarded it to him, but I'll get to that right now. So, for all the scientists pushing his tests lately, they are very, very thankful that he died in August. Because if the man was still alive, there would be big problems. The reason why is because he never intended on his invention to be used for the testing of something like COVID-19. Now, obviously, you guys know I'm not a doctor, I'm not a scientist, so I will just let Kary Mullis speak for himself. This was something that he said back in 1997.
Do they misuse PCR to estimate all these supposed free viral RNAs that may or may not be there?
I think misuse PCR is not quite. I don't think you can misuse PCR. No, the results, the interpretation of it. See, if you can say, if they could find this virus in you at all, and with PCR, if you do it well, you can find almost anything in anybody. It starts making you believe in the sort of Buddhist notion that everything is contained in everything else, right? I mean, because if you can amplify one single molecule up to something that you can really measure, which PCR can do, then there's just very few molecules that you don't have at least one single one of them in your body, okay? So that could be thought of as a misuse of it, just to claim that it's meaningful. It's not an estimation, no, it's a really quantitative thing. It tells you something about nature and about what's there, but it allows you to take a very minuscule amount of anything and make it measurable and then talk about it in meetings and stuff like it is important. See, that's not a misuse, that's just sort of a misinterpretation.
So Kary Mullis, the guy who invented the PCR test, the test, the gold standard for coronavirus testing, says that people who use his invention to test for these viruses are getting results and they are misinterpreting them. This is earth-shattering. And obviously, the people truly in charge, and we know who they are, one of them was on this show on Meet the Press, how this video started out. These people understand and are doing this all on purpose. Are there doctors, your local doctors, that understand and know about? Yeah, I mean, there's some major malpractice going on, but that's the ignorance of education, I guess. How can you argue with the guy who invented this test? It's impossible. I would love for Bill Gates to tell us how Kary Mullis is wrong, how it's a conspiracy theory. Please, Bill Gates, tell us how he's wrong. And you guys, if Kary was alive today, they would have a huge problem. So no telling, he died of pneumonia, ironically, in August. But there is plenty of evidence of Kary in the years way before his death where they tried to misuse his invention, and he openly disagreed with them. One more thing about the testing. All of the anomalies with the testing. We see a papaya testing positive. We see a goat testing positive. We see chicken wings testing positive. We see tons of false positives. We see all of these people that are, quote, asymptomatic or no symptoms, not sick whatsoever, being tested positive for this thing that they call COVID-19. Well, as you heard Kary Mullis say, it's like the Buddhist religion. And I'll chop this saying up, but everything that is within us. Well, yeah, in a molecular level, everything that is within us. And that's why you're seeing this. And they have manipulated this invention to create the biggest scam ever known to man. Now, Kary is not held in high regard in the science community before he died. And here's why.
The first time I really questioned it, I was working on a project where we were measuring HIV in people's blood at this place called Specialty Laboratories in Santa Monica. I was just a consultant there. I came in about 3 days a month, and we were working on that. And at some point, we needed to re-up our grant from the NIH to work on that, and I had to write it. And so the first line of that was HIV is the probable cause of AIDS. And I wrote that, and then I said, well, I need a paper, some kind of scientific paper, to reference that statement, because when you make a statement like that, that's like a fact. You need to say, here's how come I know that, right? You put a little 1 if it's the first statement you've made, and then you put down at the bottom of the paper you have a 1, and you say, here's a paper by somebody that describes why that statement's true, right? And so I said, well, what's that? I don't know. Let me think about, what is that paper? Who do I go to for that? And I looked around, I asked a couple of virologists at that company, and they said, no, you don't have to reference. I said, I have to reference that because I don't know where that came from. How do I know that? And it turned out that nobody knew it. There wasn't a scientific reference, like a paper that somebody had submitted with like experimental data in it and like logical discussion and said, here's how come we know that HIV is the probable cause of AIDS. There was nothing out there like that. Nothing.
Tell about your experience when you met Luke Montague for the first time and you questioned him about his
Well,
to get a reference for HIV since he is the one who...
by the time I met Luc Montagnier, I had met a lot of AIDS researchers at meetings, and I had always gone up to them. If they talked like they knew about HIV and AIDS, I always went up to them afterwards and I said, where can I find a scientific reference that I can use for my... Remember I said I had a sentence there. It said HIV is the probable cause of AIDS, and I needed to have that backed up by something before I could write it and submit it. And I went around, I asked a whole lot of people. I said, well, the people, I can't find it. First I looked for it, just in like computer searching kind of stuff like that. But then I said, there's got to be somebody that knows this. So you go to experts and ask them. And so I asked all these people one after the other, and none of them had it. None of them. And I was getting really freaked about that. That's when I first started saying, they don't know. Nobody really knows. This whole thing is a big sham. It's ridiculous. But then finally Montagnier came to there was a special little seminar down in San Diego where an old friend of Robert Gallo's, Flossie Wong-Stahl, was opening up the Department of AIDS Research down in San Diego. They had big, lots of money involved, federal money, and they had Montagnier come there and give a talk. And after that, they had a little wine and cheese thing, and I went over to Montagnier afterwards, and I said, Dr. Montagnier, I can't find a reference. I can't find a reference to go with the statement HIV is the probable cause of AIDS. I'm sure you can help me. And he knew that he probably should be able to help me. And he said, well, why don't you quote this new work, and by new he meant like something that came out this year, right? This new work about a virus that can kill monkeys, or I think it was not monkeys, it was like something related to monkeys, some kind of a baby, a little ape. And I had read that, and I said that didn't, it was like supposedly going to be a model system for studying AIDS, that somebody had figured out some kind of retrovirus that passing it back and forth between various mammals, they could finally put it into chimpanzees and kill them. And it killed them in about a week, and it didn't kill them in there was nothing like AIDS there. It doesn't kill you in a week. This is totally ridiculous. None of the symptoms were the same. And I said, well, I read that paper, and I didn't see any connection between that and AIDS, and I don't think that would be a real. I wouldn't want to use that as a reference. And I don't remember exactly what he said, but I know he walked away. Oh, no, before he told me about that paper, he said, why don't you use the NIH, like the CDC report? And I said, well, I looked at that, and that was not a scientific paper. And then he said, what about this other thing, this like paper that had just come out about a month before, and a lot of fanfare associated with that paper, but it was total crap. It was like, yeah, if you get $2 million, you can figure out how to kill a primate with a retrovirus. So what? Doesn't have anything to do with AIDS. It didn't look like AIDS. It didn't smell like AIDS. It wasn't AIDS. It was just like, got a retrovirus that can kill a chimpanzee. So what? So I didn't get any more out of him. He walked away after that. And the people standing around, by the way, who were his colleagues there, looked at him like they were thinking he should come up with a better answer than that. But he couldn't, and he just turned around and walked away. I really thought he'd have an answer. I really did. I mean, that was my last, I was right at the edge of my faith in the system, but I thought Montagnier will know why he thinks HIV causes it, and he'll tell me. He'll say, because of this study, but he didn't have that. None of those guys have that, and that's why they're so weird, That's why they don't want to say, they don't want people like me walking up and asking them those kind of questions, and they're willing to go to great lengths to prevent that. They're out on a limb. I wouldn't want to be there with them.
And that is why I conclude that Mr. Mullis was one scientist with integrity. If we look at his Wikipedia one more time, this says that a New York Times article listed Mullis as one of several scientists who, after success in their area of research, go on to make unfounded and sometimes bizarre statements in other areas. This is because Mullis expressed disagreement with the scientific evidence supporting climate change and ozone depletion, the evidence that HIV caused AIDS, and asserted his belief in astrology. Mullis claimed that climate change and HIV/AIDS theories were promulgated by a conspiracy of environmentalists, government agencies, and scientists attempting to preserve their careers and earn money rather than scientific evidence. Amen. By the way, I will leave a link in the description of this video of a phenomenal scientific article breaking all of this down